Welcome, everyone. I hope those in Europe had a chance to have a restful evening. And I know our colleagues in the Asia Pacific are continuing their day. And I hope our colleagues in Africa as well had a bit of rest from yesterday. It was a long run. And we're really going to have another full day. And I want to make sure that everybody's aware of what it is that we'll be doing today. For those who have been looking at the menu, you'll know exactly what's happening. But we'll kick off this morning, and I'll introduce our guest in a moment, Nithya Ramanathan. We'll follow with Jean Guo, and she's working with digital refugees. We'll then go and spend some time, and you've talked about it a lot over the last 2 days, Bcash, and we'll get to meet the CEO. That's Kamal Kadir. Will be very exciting to hear from him. And then we'll have dialogues with CEOs on how we can make social transformation happen through technology. We'll hear from a discussion around correspondent banking, and then we'll start to wrap things up. I want to make sure that I give a proper introduction to Nithya Ramanathan, so I think we'll just bring her up on stage. Hi, Nithya, you're on mute. There we are. You well?
Hi, Tom. Hi, everyone.
So one of the reasons that we wanted to have a few sessions where we invited some real stars in the world of how do you take data and technology and make it work in emerging markets and in markets where we wouldn't likely see being first movers, we felt we needed to bring a few folks that really understand this world. And Nithya is one of those. Just to give you a little bit of information about her, she's the CEO and co-founder of Nexleaf Analytics, a nonprofit technology company that partners with country health ministries. So she supplies the data they need to improve the health of their people, and that currently protects them. If you look, for example, in the vaccine work that she's doing, all of us know a COVID vaccine, she is supplying the vaccines for 1 in 10 babies born each year. And Nithya, is that in the emerging markets or that's in the world?
It's globally, and it's the data to protect those vaccines. And
wonderful.
We'll talk about that a little bit as we'll get there.
Wonderful. Okay. So one of the labels that she's been given is a tech for good pioneer, and she has been working in this space for several years now. Amazing growth and development in the work that she's been doing. She has a PhD in computer science from UCLA and a BS in electrical engineering from UC Berkeley. And she is the winner of several awards, won the Hedy Lamarr Award for Female Tech Pioneer, and was named a Gavi Got Life Champion in 2008. And she'll say more about Gavi. And in the foundation that I'm in, the Tällberg Foundation, she received our leadership award this last year, in 2 years ago in 2020. So I think I've managed to get everything I need out there to introduce you. Nithya, are you ready to share with us a little bit of what you're working on right now?
Yeah, I am. I'm really looking forward to it. And thank you so much for having me.
Very welcome. It's in your hands now.
Okay. So we can start with the first slide. I see it. Okay, great. So hopefully everybody can see that. So thank you. As Tom mentioned, my name is Nithya Ramanathan, and I'm really excited to be here. One of the things that I think a lot about is how data can be used to transform systems across all sorts of sectors. So it was really exciting to be part of a conversation around financial sector change. So a little bit about me, I'll just tell you a little about my story. That is me, it's a picture of me. There I was, an American woman, up to my knees in muck. And I was wielding these strange metal boxes. So I was actually in rural Bangladesh at the time, and I was deploying sensors that I'd been building through my PhD to learn why the groundwater was making people sick. And I attracted some attention. And next slide. So I was really interested in Bangladesh in understanding how these networks of sensors and the promise of big data could really transform our understanding of important environmental and health phenomena like arsenic. But my tech, I realized as I got there, simply measured the problem. And I'd really come to connect with the local community that was there. And they were expecting a solution. They didn't really care about my grad student paper that I was writing. And so as I sort of went through this over the next few years, I started to really see the gap between just kind of studying and understanding problems and actually solving them. And so next slide, I decided to raise funds and hire engineers from the city in order to dig a deep well that would bypass the arsenic. And we celebrated. But as I boarded the plane, I thought, what if the well breaks? And I'm an engineer. I know that's not if, but when. When the well breaks, who will fix it? Who will pay for it? And how will they even know that there's a problem in the first place? And that moment really set my trajectory from there. I was so just kind of devastated that we had deployed this solution and then we had left it all on its own. And next slide. I actually learned that that is how life-saving equipment is often deployed, mostly deployed across Africa and Asia, especially, in countries with limited infrastructure and power. And I thought, I don't want to be part of creating this extra landfill. I don't want to build just sensors that measure how bad a problem is once it's really bad. So I kept thinking, what if instead we brought together the sensor technology that was really getting accelerated at the time, together with the equipment that was there to save lives? What could be unlocked? So to tell the story of data, which is what Tom asked me to tell you about, I do want to take a detour and talk about vaccines. Next slide. So I think at this point, most of us know vaccines are one of the most cost-effective ways to actually help our economies run, help us all get back to work. But vaccines won't work if they get too hot or even too cold. So distributing vaccines actually requires refrigerators. Next slide. Big, and next slide, small. And these need to function at every leg of a journey to keep vaccines cold. Fridges literally can save lives in this way, but like any kitchen appliance or water pump, they break. So one study in South Asia found that actually more than half of all vaccine doses were exposed to dangerous temperatures. That means that the children who would have received those vaccines may not actually have been protected. So fridge failure is a big problem, and it can actually happen anywhere. So a few years ago in California, where I live, Stanford Children's Hospital actually had to revaccinate and contact over 1,500 families about revaccinating their children because a fridge had been malfunctioning for months. So next slide. The thing is, what if you can't just call families up on the phone? What if they live a 6-hour walk away? What if that first shot you have is your only shot? The stakes are really high when it comes to vaccinating, especially in rural areas. And this is especially true with COVID vaccines. Now, in May 2021, next slide, so just last year in Tanzania, failure of a fridge with our smart sensor actually prompted a fast response from the regional immunization officer. Next slide. And a technician visited the site, found some faulty wiring, and all the vaccines were kept safe there. This was all because real-time sensor data made the difference. A nurse was contacted right away when there was a problem, and she was able to take the actions she needed to actually keep this fridge running. And a technician can even look at the same dashboard, next slide, and can collaborate with people on site in order to figure out what's actually going wrong with this fridge and what are and to mobilize the resources needed to fix that fridge. Next slide. So my team and our partners have scaled our sensor technology to more than 15,000 storage points across Asia and Africa. And these sensors are, next slide, protecting the vaccine supply for 1 in 10 babies born on Earth globally each year. And we're continuing to grow. But it hasn't been easy. So I wanted to just share one story from sort of a day in the life. So this was early on when we were making our earlier sales, and the government of India had decided to make a major purchase from Nexleaf. And so we were verbally given the message that we had won the contract. And you can go back to the previous slide, actually. So we'd gotten verbal messaging that we had won the contract and that we needed to deliver within 2 months. And so I had to put in a very large amount of money at the time in order to start manufacturing, and just kind of had to, all hands on deck. And after about 3 or 4 weeks, we purchased the parts, we started manufacturing. I actually got a phone call from the government saying that they had decided to cancel our contract. And so they gave me 24 hours to show up at a meeting and actually make a case for why we were still the right vendor. And so I jumped on a plane literally like a few hours later, landed in the meeting, showed up, and 4 hours later, I came out with our contract intact. So what was really going on here? Why was the government of India willing to trust us? It wasn't actually the sensor technology. And so I want to use this example to actually share what we do and why it matters. And I think this relates because I know that you all are working at banks that think about humans, the human qualities, human value. And so I think something very similar actually was happening for us. And we've been really trying to leverage this experience in everything that's happened since. So I want to tell you a different story in order to share how we work. Next slide. So I want to go back to the very beginning of our work. This is in 2011. And to the very last mile of the vaccine supply chain. So this is rural Kenya. And this is where we learned actually the problem of how traditional data systems that are deployed are totally broken. And it's how they were being built at the time. So this is an example. This is Charlotte. She is a nurse in rural Kenya, and she spent a lot of her time filling out paper charts that didn't actually help her at all. So why would she do that? Well, nurses had to fill out these onerous paper charts because they were mandated by the World Health Organization sitting in Geneva. So literally what would happen is Charlotte would send these charts to her supervisors. Next slide. And those supervisors would bundle the charts and send them up to their supervisors. And these charts would literally get bundled and sent up the chain until they finally landed in Nairobi. And Charlotte never got any value from these charts. And so what we started out doing was something very basic. We built this device that automated that process for her. And we thought, okay, this might be it. We're just, freeing up an hour of Charlotte's day every day. And she might be happy about it. But instead, what happened, and you can go to the next slide now, because Charlotte now had objective data in her hands, this was objective proof of the fridge not functioning. She no longer had to convince people. And instead, she had this objective proof, this dashboard that they were all looking at as well. So everybody was looking at the same dashboard. And Charlotte became much more proactive. So she went from sort of a passive person in this system, filling out these paper charts, not really paying attention, to actually becoming activated. And she started to catalyze actually quite a bit of change. She took the data, she talked to the technician, she would talk to her supervisor. She even talked with her supervisor's supervisor. And so this objective data really empowered Charlotte to actually take charge of her situation. And so this, and next slide, actually this same set of rich conversations needs to take place at every link in the chain across transportation, trucks, and everything. And so I was discussing our approach with Tom, and I always learn so much when I get to talk with him. And so we were chatting last week, and he had actually suggested that perhaps what we're starting to build is this term that I think he coined on our call, a data value web. So I went back and thought about this quite a bit over the past week. And so I hope this is actually useful. It's still sort of new thinking for me, quite honestly. But the more that I thought about this and kind of read what was out there in terms of a value web, I think it really captured this sort of human element of what we are doing with this data. So the idea of everything that we do is that we have been shifting the entire global health system from a model that is extractive, where you've got the World Health Organization unwittingly extracting data from every other level of the system, and we're moving it to a mutual benefit, where both stakeholders, multiple stakeholders who come together, can come together around the same data. So there's very much a mutuality of accessing that data, but also getting value from that data. So rather than just like sucking up this data, every actor in the system gets value. And then it's really about the conversation that happens. So finally, the sensor data, that's one thing. But the way that we are now presenting this data in a shared format, it's really about the conversation that's happening together. And that's where the mutual value really comes in, is through this shared insight that Charlotte and the technician and her supervisor get together. And that through this conversation, actually each actor is adding additional value to the data. They're adding context, they're adding a deeper understanding. And so they're actually adding value to the data as they also get their own value from this data. And that this data can pass through many stakeholders and actually creates a sort of many-to-many interaction. And part of what's really interesting is that, unlike a traditional value chain or even the way a value web is addressed, it's usually applied to tangible commodities. But here we're actually creating a data value web, and data is literally infinite. We don't have to limit the access to this data. So there really is this ability to move from sort of a win-lose situation to this win-win situation, where Charlotte gets value, the technician gets value, and we're actually everybody's able to focus outwards rather than on their own pain. Everybody's working together around the table to solve a problem. So this is really how we moved from a traditional kind of extractive use of data to a mutual interconnected use of data. And so this data is essentially helping to break across silos, open up very new conversations, and really kind of advance a lot of creative, innovative thinking across the health system. And so our technology is being used in over 25 countries now. And so this kind of transformation and change, as you can imagine, can really be a multiplier effect. Next slide. And there's really so much that can be done with this data. Actually, we can go to the next slide. So this isn't just about vaccines and vaccine fridges, but real-time sensor data can change the game by providing this common source of ground truth and enabling this kind of coordinated action that's critical to maintain any equipment and really have any kind of system move forward. Next slide. And this isn't just limited to vaccine fridges in a clinic, but next slide, really any life-saving equipment, from a solar panel on a hospital to, next slide, ventilators and oxygen tanks. But for these benefits to be realized, we need to invest in these types of data systems, of course, but also ensuring that local people, those closest to the problems, are in the driver's seat and they are getting mutual value from this data. So back during my PhD, which was about 20 years ago in Bangladesh, one of the things that really stuck out to me was that people would always say, the sensor doesn't lie. The sensor doesn't lie. And that's actually not always true, but it's the belief in this power of data. And really, it's the belief in the power of truth that uniquely catalyzes actions and stakeholders, really catalyzes stakeholders to come together around a common purpose. It's not about the technology, but really the conversations that technology can stimulate. Thank you. Oh, Tom,
Nithya, that was a very rich description of what you're doing, and I hope that people are, as they're tuning in, they're starting to see what a world you're creating as it relates to how we can have this mutual connection through data, and the data becomes a kind of enabler. I'll kick off the questioning, and I think I want to go back to a kind of your start in doing all of this, and I've heard the things that really worked. I want to hear a little bit more about the barriers that you had to overcome in order to make this happen, if you can share a few of those.
Yeah, so many. One of I'd say that this is kind of top of mind for me, but one of the barriers that persists is that we are not a traditional vendor. So yes, we sell these devices and we sell them at a profit. We believe in a sustainable business model. But this market for data didn't actually exist in global health, and it certainly didn't exist in the vaccine supply chain. So while we were selling these devices, we were actually helping to create the market for the devices at the same time. And that put us in this sometimes conflicting position. So you mentioned at the beginning, I do work very closely with Gavi, and Gavi is the institution that deploys over $1 billion a year that helps about 60 of the poorest countries buy vaccines, build their health systems. And we became a very close, trusted partner of Gavi because of this unique, powerful, but also bizarre role that we played, both as a vendor and as a sort of systems kind of looker and observer. And so that created a lot of conflict for us over the last 12 years. Even to this day, there's actually this conflict because we do have access that other vendors don't. It's true. We do. We're part of conversations with Gavi where we are helping them think differently about data. We're literally helping Gavi understand what is the value of data? Why should they be investing in data systems? I've helped the board think about why should they be building a $200 million fund for data. So it's tricky. These are messy kind of conversations and decisions. And it hasn't always gone well. We've lost sales, we've lost deals because of that kind of role that we play. So that's just one example of many things that have gone wrong over the years.
I think our banks can relate, Nithya, because in many ways, as a values-based bank, you are really trying to put an ethical frame around a banking system, right? You're trying to do things that work for the real economy, that focus on the real challenges facing humanity. So we could adopt you as a values-based person. Sonia Felipe is asking a question along those lines. What are the main challenges to developing an ethics around data?
I love that question. It's perhaps not what you might think. And actually, one of the very first conversations that Tom and I had, maybe about a year ago now, was about this. I think what's been hardest is that often the ethics in data systems go directly against the business models for scaling data systems. And all of us are in business. We're all here to, in part, sustain and grow our businesses. And so when you have ethics coming into direct conflict like that, I think it can be really challenging. So I'll be really concrete. So in vaccine systems, what's happened is, unfortunately, business models for sensor companies like mine, they've been built on this kind of old way of thinking that the way to capture value is to capture the data, and that those two things are equivalent. That's an old school way of thinking. We no longer have to capture data. Actually, we can provide value on data that proliferates. And that's the kind of new thinking that we're trying to bring. But the ethics that go along with that are that countries actually are the ones who own this data. Imagine that there's cows in a country and a company comes in and says, okay, country, you may own the cows, but we own the milk coming out of those cows. It doesn't really make sense. And that's what's happening in data. So you have data colonialism. You have all this data being extracted out of countries. So one of the core data ethics that we've been helping to build out is that countries own their data. But that does come in direct conflict with most people's business models. So what we're simultaneously trying to do is help these other companies, our competitors, come along with us and see that they can actually provide value on top, and they don't have to continue to like extract and hoard this data. But it's tricky. You don't ever want to get in the way of somebody else's business.
And it sounds like you are, but I think this is a continuous management process. If we think about the local actors, and I'm thinking there are many local actors who are watching us now who are and bankers who are making a difference in their own communities. How can we draw on the wisdom of local actors through the way in which you're framing use of data in this way? I mean, it feels like not only is there so much that you're bringing to really kind of tap into understanding how they can surface and use data, but there's some real wisdom we're not capturing sometimes.
I was thinking about this. I'm curious if this kind of speaks to your question or not, Tom. So, tell me if I'm off the mark here. But one of the things that I was thinking about is this way in which people who work with data, the data knows more than we realize. What I mean by that is, as individuals, I think often we don't have access to our own data, but we also often don't have access to these basic insights about ourselves. And I do think there's this, when I think about the potential for banks and local actors, the question that came up for me that I was really wondering is, what is the data that banks have that actually could bring value for local actors that doesn't disrupt any business model, but actually kind of helps in this very mutual way, in the way that the sensors actually helped Charlotte, the nurse, do her job better and open up all these other possible pathways of value for Charlotte that weren't even anticipated. I mean, it's just a temperature sensor, but Charlotte really was able to take that and open up these other pathways. I wondered, what are ways in which this data can be reflected back to individuals to help us understand our behaviors, perhaps better than we understand them ourselves. So it's more a question back to others, the experts around the room, but that was one of the things I was wondering about.
I think this is a very good example you're using, because quite often I will ask a leader, so how do you lead? And of course, it's very unconscious, but yet there's lots of observable data. I think this is it's a really good thought to simply find more ways that people can create pathways to their own information. We have another question from Adriana, our research colleague here at the GABV. She said, the data points you speak of could be referred to as inputs in a process. We increasingly see in finance that there is a demand to demonstrate impact, which is being implemented through the measurement of outputs, number of jobs, number of schools, etc. How do you see these data points contributing to a conversation that generates value for those along the financing chain, similar to the one that you shared with us? So she's looking for the analogy in our space, in the values-based banking.
Yeah, and again, I mean, I wish we were sitting around a table where we could hear, how others are thinking of this. I'll share a little of how I might think of this. So the first thing that I'll say is I think traditional monitoring and evaluation tends to get things backwards in that there's a real focus after things are done to kind of look back and study something, look back and study a system. And I think what's really hard about that for any of us, right? If somebody asks us, what did you get wrong last year? You were in a meeting a year ago and, the meeting didn't go well. What did you get wrong? It's really hard for you to truly remember and really engage in that process. You're maybe more likely to be defensive or, just explain away something because you don't remember. And so we really focus on, rather than the sort of post facto monitoring and evaluation, which is rigorous. So, but often comes much after the fact. We really focus on the conversation in the moment. And so we talk a lot and think a lot about how do you give that real-time feedback to people in the moment from this data. So I guess the question that I have, or that comes up for me when I see Adriana's question is, what if these things here can be managed in the moment? So can leaders manage if they knew the number of jobs or number of schools in the moment? And, I don't know because I don't know these decisions that are being made. And I don't know the context, but that's really the question that we ask ourselves. We don't want to get too tactical, of course, but we really try to ask ourselves, what are the types of behaviors and decisions that can benefit from that real-time feedback? I actually had a temperature plot I wanted to show, and my 9-year-old son actually went through my slides and he was like, no, this slide's going to be very distracting. But the reason I wanted to show this temperature plot was because it looked just like a stock ticker, and I think there's this way in which we're so used to seeing stock prices go up and down and making decisions based on that. And that's actually a lot of what a technician can do. They can look at this, what seems like nonsense temperature plot, and they can make pretty, insightful decisions about what to do. So that would be my question here is, where can it really influence the decision? I guess the final thing that I'll say is I think too often we're still wowed by data and we don't stop to ask ourselves, what is the question that I really have? And am I going to do something different with the answer to this question? And who else do I need to consult in order to get a holistic perspective? And so, I think those would be all the questions that I would be asking when thinking about how these data points can be contributing to a conversation.
I think what's interesting for a number of our banks, Nithya, is that they also have to engage with governments. They have to engage with regulation. I'm sure this is a space you need to engage in as well. There's nothing more regulated than health in many, many countries. And I'm just wondering, is there any learning for you of how you've been able to, in some ways I see through the Gavi process, that, and actually you need to tell us what Gavi stands for. It's an acronym, right?
It used to be an acronym. It used to stand for the Global Alliance of Vaccines Initiative, but it actually now just is Gavi.
Everyone knows Gavi. But how can we learn from what you're doing about how to, this may be too strong, manage governments? So, or support them in they're regulating us?
We probably have a different relationship. So we're always really clear that we don't manage governments. Governments are actually our direct customers. So it probably doesn't totally translate. But when I think about regulators and the relationship with regulators, the equivalent is probably the World Health Organization and Gavi for us. And the thing that we are constantly trying to do, similar to that value web concept, is we're constantly iterating our business to also think about how we can bring value to WHO, how we can bring value to Gavi. So I'll just give one really concrete example. It turned out that the World Health Organization does this very intensive post-market monitoring exercise. So the World Health Organization actually approves every fridge, every truck, everything that gets sold for the vaccine supply chain, and they have to approve it. And then they want to know, once the technology's gone on the market, how well is it working? And this post-market monitoring exercise is incredibly complicated to do. You deployed a fridge to Abuja in Nigeria, like, it's hard to know how it's doing. But it turned out that, of course, this the data is it provides real-time feedback on the performance of these post-market monitoring solutions. And so we actually package the data in order to share it with WHO. And WHO has been getting value out of this. And so it doesn't, make our relationship with WHO any easier per se, but I think it just broadens WHO's perspective, and suddenly we have a shared perspective. And I think it just changes the conversations that we're able to have. So it's always hard to know. I mean, these things are often intangible, but when I think about working with regulators, I do think of them as like, well, what are their pain points? And there must be something that we've got, on the table that can help them. And so that tends to be our approach. Banking is very heavily regulated, so this could be incredibly naive, as a suggestion.
I don't think so. I think you're turning around the thought, because so often in the banking community, we're really, I don't want to say victims, but you have to deal with the regulation that's coming. But I think you're asking a really good question: is what are their pain points? Where do they need help? And I think a number of our banks have also indicated that regulators need to see that there are some other ways of banking, and that's happening in the global lines. So that's helpful. I want to go back to a question that has come up in your work that relates to dealing with cultures and being respectful of different cultures. And I'm just wondering, what are your thoughts about how, as you're taking your non-extractive approach into various cultures, and it's a fairly broad question, but encounters, experience with that, understanding and being respectful of the different ways that people are approaching their health systems and their water systems?
I've learned to be really humble, and I've learned that I don't know nearly as much as I think I do. And so I think the good thing is that we're bringing something that people don't normally have access to. But in bringing that new technology, new solution, we are incredibly humble. And I've learned that through the years. I didn't always used to be. I did actually come into conversations really excited about my ideas, wanting to assert what I knew, and learning in a series of painful conversations, how many assumptions and how much I, didn't understand about somebody's context. And I might think a vaccine fridge looks the same, across Kerala in India versus, Kilifi in Kenya, but the broader context around that fridge is totally different. And I can't even bring that knowledge that I might have from one state in India to another state in India. So I learned that through a series of mistakes and, sort of messed up conversations. And so mostly I've just learned to listen to people, really understand what are their experiences, what are their challenges, and really think about, like, how do we get the most value out of this data for this person in front of me and their pain points. I do think that there's a lot of commonalities and a lot of patterns, but I've learned not to come in with the patterns first. I've really learned to come in with, listening, and then from there, sort of slowly building the patterns.
Last question I'll ask you is, we have a number of chief executive. You're a chief executive. You're responsible for an ever-growing team. I'm wondering what you're learning as a chief executive and the ways in which you're needing to manage and lead your team. Are there things in what you're doing that have surprised you and really made you realize that you can up your game? And
I am constantly learning, actually, from our team. And I know that's such a trite thing to say, but I've been thinking about leadership a lot through the pandemic, especially. And it's interesting, the more that I've learned, my understanding of what really good leadership is has actually become simpler and simpler. And so this week I was having a casual conversation with a team member of mine in Kenya, actually. And she and I were talking about, like, what is leadership really? And kind of came to this place of, like, leadership really is just about care. It's about care and intention. And really a lot of what we describe as leadership, we can kind of boil down to this lens of, like, am I showing care for other leaders, other team members, other cultures, other governments, other customers? And that care comes out in so many ways, big and small. It comes out in the memos that I share. It comes out in the context that I set. It comes out in how I am as a manager. Am I, controlling? Am I not? Am I setting context? So it's just something that literally just came up today. So I thought I would share that. But I think one of the most kind of privileged things about being a CEO, I mean, it's a hard job, it's lonely, it's isolating, all those things. But one of the most privileged jobs is that we do get to learn from just everyone on the team, and we kind of have that doorway. And so, yeah, it's one of the joys. But yeah.
So we have one more question. I thought this was going to be the last one, but again, internally, how do you enable engagements and conversations that are generative and allow you to identify the needs of your stakeholders? So this is not so much the question for your team, but now the question for your stakeholders and the ways that you engage, with reference to your WHO story.
Yeah. I'm a really curious person by nature. I really love to hear other people's stories. So I would just really double down on that. I'm always surprised by what people are willing to share with you when you are authentically wanting to listen. And I think I just exude that. I think even my story with the government of India, where my business would have gone under. They'd pulled the contract, we would have gone under, because I had put in $1 million and there was no way to kind of recoup that. And so I think I won that because I went in there and I just really listened to what their true pain points were. The surface pain point was that I was an American and that I didn't run a company that was, was started in India. It was based in India, but it wasn't started there. But as we got into this 4-hour conversation, and we really understood their challenges, it was amazing what we were able to the shared territory that we were able to actually come out of and come out with.
Nithya, I think we're coming up to our concluding part of this program. I just want to say, you may feel that you're focusing on data. What we're all hearing is wisdom. And so you've been able to translate your data into real information that people can build relationships with and use, but you've also found a way to distill that into some real lessons that I think help our banks. So thank you very much for that. And we're super thrilled that you could join us today. I know it's late where you are. Thank you very much.
Thank you so much for having me, and to everyone who's part of this session. And I wish everyone a productive rest of the day. Thanks, Tom.
Thanks, Nithya. So for everybody who is on, we've got Educating Refugees to Become Digital Natives coming up right away. So we've got a 10-minute break. So we'll see you in at my time, 9:55.